Hey folks, I'm Dr. Gabe Rodriguez and I practice concierge medicine in Helotes, Texas. This month's Medical Minute will be on obesity because obesity has become a growing epidemic in our society and it affects many organ systems including cardiac, respiratory, musculoskeletal, endocrine, GI, and mental health. Newsflash people, approximately 35% of U.S. adults are obese. I will start with the basics, move on to the causes, talk about risk factors and prevention, and then end off with 3 treatments. All of this will take place in about 3 minutes total. The basics: obesity is excess adipose tissue. Technically speaking, obesity is a BMI over 30. Overweight is a BMI between 25, 29, and morbid obesity is a BMI greater than 40. Specifically, abdominal obesity is associated with an increased risk of morbidity and mortality. When I speak of abdominal obesity, I'm talking about abdominal circumference at the umbilicus, the belly button. For males, it's greater than 40 inches, and for females, it's greater than 35 inches. Anything greater than those numbers, that's obesity. Oh yeah, folks, obesity affects both males and females equally, and it has the highest incidence in your early 20s, also known as the college years. Causes of obesity can be broken down into 4 categories. Number 1, obesity can be caused by an imbalance between food intake and energy expenditure. Number 2, there may be an underlying organic disorder, such as psychiatric, hypothyroid, hypothalamic, and insulinoma, or Cushing's. Also, medications such as corticosteroids, atypical antipsychotics, and antidepressants can be a cause. Finally, genetics also play an important role. Risk factors. A few risk factors for obesity include parental obesity, a sedentary lifestyle, consuming high-calorie food on a regular basis, and believe it or not, watching TV greater than 2 hours per day is a significant risk factor. How can we prevent obesity? Well, here are a few suggestions. First, daily exercise. 30 to 45 minutes a day is great. 2, limit TV viewing. 3, limit your portion size when you sit down for a meal. 4, avoid high-calorie food intake such as desserts, sugar-sweetened drinks, etc. And 5, avoid smoking and limit your alcohol intake. Finally, what are some treatments for obesity? First-line treatment focuses on a patient-centered approach: diet, exercise, behavioral modification, behavioral therapy, counseling. Keep an exercise journal, a meal journal, commercial weight loss programs. Second are medications. First-line medications work on decreasing absorption of dietary fat, while second-line medications work on suppressing your appetite. Third, and your final option, is surgical intervention such as gastric bypass, gastric banding, etc. That's all I have today for you folks on this month's Medical Minute topic of obesity. Thanks for listening. Take care, be well, and remember, your health is your greatest wealth. So long.